The starting position of the push-up is performed by placing the body in the plank position. The core muscles are isometrically contracted. The core muscles involved are the rectus abdominis, the transverse abdominis, erector spinae, and external obliques. These are used as stabilizers. The head, neck, and spine are in a neutral position while all in line. The hips may be in a slight posterior pelvic tilt due to core activation. The legs are fully extended and placed together. The shoulders, elbows, and wrists are stacked at 90 degrees of shoulder flexion. Elbows are not fully extended. There is also a concentric contraction of the triceps brachii and deltoids. The movement phase is performed in the sagittal plane. With the core isometrically contracted, the body is lowered through elbow flexion and abduction, as well as horizontal shoulder adduction. The descent phase ends once the elbows are flexed to 90 degrees and there is 90 degrees of horizontal shoulder adduction. The primary mover involved is the pectoralis major, assisted by the triceps brachii and the biceps brachii. At the bottom of the movement phase, the pectoralis major is eccentrically contracted, and the anterior deltoid and biceps brachii are concentrically contracted. There is also scapular retraction visible due to the concentric contraction of the rhomboids and infraspinatus muscles. The upward phase is performed by concentrically pressing the body upward through the pectoralis major and triceps brachii. Elbows are extended, but not fully, to prevent elbow injury.
Here we see that the athlete is having issues performing the proper form of the push-up. Since her core is not engaged, we can see that she develops a minor anterior tilt in the starting position. Upon reaching the bottom of the movement phase, her elbows do not reach a full 90-degree flexion, nor do her shoulders reach 90 degrees of horizontal adduction. Her legs also do not stay straight, as we see a bend at the knee. Her attempt to fix her elbows flexion results in a disengagement of the core stabilizer muscles and a change in her shoulders from a horizontal adduction to a vertical adduction. We can also see that there is no scapular retraction involved. In order to fix the athlete's push-up, there needs to be some conditioning exercises performed to allow proper form. The first of these is a plank. The athlete starts by placing her forearms on the floor in a straight line from her shoulders. This will allow equal distribution of her weight. Her elbows and shoulders are stacked, and her head, neck, and spine are all in line with her hips. There is also no bend at the waist or at the knees. As the trainer comes to adjust the athlete, she overcorrects herself and begins to go into an anterior pelvic tilt. The trainer will then place her hand on the athlete's stomach to remind her to engage her core muscles. The athlete then pushes up into a plank push-up position in order to better simulate a push-up. The second exercise is the physio ball rollout. This is used to help strengthen the shoulder muscles as well as continue to engage the core. As shown here, the athlete's core muscles are engaged while the shoulders are used to help walk the hands out from the physio ball. The head, neck, and shoulders are all in a line while maintaining a neutral pelvic tilt, if not a slight posterior pelvic tilt. It's important to note that not all athletes, when starting out, will be able to walk out as far as the athlete performing the action does. Here the athlete has trouble performing the movement as she loses control of her body and begins to fall off the end of the physio ball. If the athlete is having trouble maintaining stability, an assist can be made by supporting the hips as they walk out. This spotting technique should not be overused as the athlete will begin to rely on it and their core muscles will not improve. The next exercise to use would be a wall push-up. The wall push-up simulates a regular push-up, however, it takes away the aspect of gravity. An athlete may perform a wall push-up in order to better understand the form required. The starting position of the wall push-up is similar to that of the regular push-up. The athlete will stand facing the wall with their arms fully extended. The wrists, elbows, and shoulders are all stacked, with the hips in a neutral position. The head, neck, and spine should all be aligned with the hips all the way down through the feet. Again, there should be no bend at the knees or the hips. While performing the wall push-up, the athlete is able to reach full 90-degree flexion of the elbows. The trainer has her hand in between the athlete's scapula. This is so that the athlete can be reminded to retract the scapula when reaching the bottom phase of the push-up. The final exercise is the modified push-up. The modified push-up is easier to perform because the overall lever length is shortened. The starting position is achieved by having the athlete start in a regular push-up plank position and dropping the knees directly to the floor. This will prevent the athlete from having an anterior pelvic tilt and will keep the head, neck, hips, and knees all in line. The wrist, elbows, and shoulders should all be stacked, just as in a normal push-up. While performing the modified push-up, the athlete should go through the same movement phase as with the regular push-up. The athlete should activate the core and descend to 90 degrees at both elbow flexion and horizontal shoulder adduction. Compared to the regular push-ups performed earlier, the athlete reaches closer to a full 90-degree elbow flexion. The athlete is still showing signs of a weak core, which is demonstrated through the anterior pelvic tilt and the arch in the lower back. After performing the conditioning exercises for a push-up, we return the athlete to a regular push-up position. The conditioning exercises are meant to be performed over a longer period of time to actually condition the athlete to be able to perform a perfect push-up. Here we hoped that having the athlete go through the conditioning exercises that she would be able to better perform the range of motion required for the push-up. Before having the athlete perform the regular push-up on their own, we added a spot assist on the waist. This assist is to allow the athlete to perform the range of motion properly. We can see that the athlete is more able to perform the range of motion through the elbow flexion than the previous attempt. Not only are the elbows closer to 90 degrees of flexion, but the shoulder is also at 90 degrees of horizontal adduction. The athlete's core is also better engaged, resulting in less of an anterior pelvic tilt. Upon reaching the bottom of the movement phase, there is also no bend in the knee. Finally, we can see that there is increased shoulder retraction. Before we noted lack of core stability resulting in an improper pelvic tilt, there's also a lack of range of motion at the elbows and shoulders, resulting in little scapular retraction and a bend at the knees. As we can see with the other athlete, our athlete was able to increase her core stability and increase her range of motion for her elbow flexion and shoulder flexion. Here we're able to see that she had greater shoulder retraction due to her increased use of her infraspinatus and rhomboid muscles.